Hi, good evening. We're here today to talk about type 1 diabetes and how it is affecting the children of the U.S. today. So, parents, this message is directed towards you since you are the main influencer in your child's life in respect to their daily activities, their health, and their eating habits. We're going to start today by talking a little bit about the background information of diabetes itself. So diabetes and with type 1 is an autoimmune response where your body attacks itself, specifically the beta cells of the pancreas. The pancreas is the organ in the body that creates insulin, and when your body undergoes the immune response where it attacks itself, the pancreas no longer has the cells required to make the insulin to release to the body when you consume sugar. Without insulin, your cells are not able to absorb the sugar that you have eaten. So it's very hard for them to do the cell cycle, which creates the energy that you require for your daily tasks. So you will feel more sluggish and tire more easily throughout the day when you have this disease. But this disease is actually completely manageable, but we would prefer to prevent it rather than to manage it down the line. So I'm here to give you some information to try and prevent the disease from developing in your children. One of the main factors of type 1 diabetes is genetics. So if you carry the trait for diabetes and you pass it down to your children, they are more susceptible to develop the disease in their lifetime. Type 1 diabetes, since it is considered the juvenile diabetes, it will occur early on in their life. There's said to be two spans, age 4 to 7 and age 10 to 14, when it will most likely occur. It can occur anytime in life, but those are the two main times. Diet and exercise is extremely important, but diet and exercise don't play too much of a huge role in type 1 diabetes development. It's more of the genetics and the environmental factors that play a role. So parents, even though diet does not play a factor in type 1 diabetes, does not mean that we want to feed the children high starch and high sugar foods all the time, even though they may be easier to prepare for them. Because they might not develop type 1, but having that kind of lifestyle and eating habits may have them develop type 2 later on in their lives. And as I said before, while diabetes is completely manageable, we would like to prevent both types from developing in anybody's lives. So some of the complications that can come along with diabetes is heart and blood vessels. Diabetes constricts the blood vessels, which limits the blood flow to the extremities of the body, which rise up and can cause chest pains, and then later in life, even heart attacks and strokes. So it's very important to manage this disease if you ever do get it, since it is something that can be lethal. Other side effects is neuropathy, so it's nerve pain, numbness or tingling in your fingertips and your toes, that also as well inch up, that cause very high discomforts a lot of the time if not taken care of. The third main one is nephropathy, which is kidney damage. Your kidneys are the filtration system of your body. So once they start to deteriorate, you may have to have your kidneys replaced, which is major surgery, or you may have to be on dialysis to have a machine do the filtering for you, which would cut very much into a lot of people's lives. It's not something you can do in a hurry. You have to, a lot of times, go to a facility and stay on a machine for a few hours a day or sometimes multiple times a week. These are reasons we want to try and prevent diabetes in anybody, so no one has to deal with any of these complications that may be life-threatening and are definitely uncomfortable. Parents talking about signs for your children. If they are developing diabetes, a couple things to look out for. If they're complaining about blurred vision, if they're hungrier than normal, if they get lightheaded or dizzy easily, when they stand quickly, if they're more anxious about things they are already used to, if they're shaking a lot, the tremors they call them, if they have unstable moods, if they get very angry or very sad within one fell swoop, which is not normal for them, that may be a cause as well. Sweating a lot. If you go to hold their hands and they kind of feel clammy, and that's not something that is typical, those are all signs that they may be developing diabetes. So immediately go to a healthcare professional so they can do the proper testing to make sure that everything is okay. And if it is not, they can start to get on the proper medication earlier rather than later, since these are just a few of the symptoms that may occur. We understand that there are social economical factors that prohibit a lot of what we talked about here, such as eating healthy, being active. You may not be able to take your child to a gym or the park, but there are after-school programs that make sure children stay active and have balanced meals at least twice a day. So you can always look into those, and a lot of them are free, and if they're not free, they are based on your income, or they can be prorated. If it's very hard for you to get around to get healthy options, there is a lot of services nowadays with groceries where they will bring it to your house, or transportation throughout the city, by the city. That may be an option as well. The last thing I want to talk about is stress. Stress is a huge factor as well. Once you feel stressed, your child is also going to feel stressed as well. Empathy is something that usually runs very high in children. So it's very hard, easier said than done, but always just count to 10 and try to relax. People will help, and there are a lot of situations where you can always speak to someone to try and get advice as to what to do. High stress situations only make things worse for both you and the child, especially if diabetes is something that's already prevalent. It is a day-to-day care with monitoring medication if that is in their regimen given by the doctor. Definitely insulin is daily, if not multiple times a day, where you may have to administer it for your child. But just remember that if diabetes is developed, it is manageable. It is not a death sentence at all. But if you feel that you may be a carrier and your child may be more susceptible, just take regular life practices to lessen the high ability that they would receive it. Even though diet is not a part of type 1, it is a part, diet and weight are a part of type 2. So for type 1, try to stay away from environmental triggers. And for type 2, try to eat in moderation, eat as healthy as possible within your means, and ask for help and advice from healthcare professionals. Even if it's not a doctor, it can be a nurse at a walk-in clinic or a pharmacist. They're always there and they should be able to help you as much as possible. Thank you and have a great day.